Are you a mother of a baby who is just about start teething and your baby has been having to deal with throwing up or vomiting and then passing loose stool? Whenever you go to the hospital, out of confusion, you are like, baby is teething, and the doctor will be like, and you feel lost because, as far as you're concerned, throwing up or vomiting and passing loose stool is part teething. Sis, you're not alone on that table. Just come closer. Let me explain. In medical practice, they believe that there is no such condition as teething. Yes, as a matter of fact, they will tell you to explain further that, okay, your baby is teething. So, and what exactly are the symptoms you're seeing? What exactly are the complaints that brought you to this hospital? What do you want us to take care of? All right. Most children start bringing out their first tooth in their 6 to 9 months of age. Yes, the larger percentage of teething children. However, there are variations in the ages. To start with, some children are even born with their first tooth. Yes, some children are born with their first tooth. Now, a few of them start quite early as 3 months to 6 months. Yes, a few of them start within that period. Then quite a few also start after 12 months. Okay, whichever age your baby starts teething is not a problem at all because every child is unique in its own way. So please don't try to compare the ages of teething of another child with your own child. They are all unique in their special ways. Okay, then in children. First thing is, what is teething? It's actually just that physiological process whereby tooth or teeth start coming out from your baby's young, beautiful gums. This process of teething can actually be a distressing period for both parents and their kids. Reason being that there is a lot of pain associated with teething in these young ones. Knowing exactly what's going on and how to reduce the pain can actually lessen the burden on both parents and their kids. So, first thing is, how do we know a baby that is about to start teething? The first thing you notice with a teething baby is the fact that the gums where that tooth is about to break for become swollen, reddish. It may be itchy or painful depending on the stage they are in. This itchiness and the swelling and the reddening of that gum, you can actually tell that the baby is about to start breaking forth its first tooth. Okay. The second thing you notice is that there will be increase in the production of saliva. Your baby will start increased salivation. Okay. The mouth will always be wet and the baby would less likely to open the mouth. That's one thing. Another thing is that that baby may start building temperature. Some babies may have rashes all over their cheeks and areas surrounding their lips. They may have reddish rashes there, while others might not have it. The next point that makes you to be aware that this baby is about to start teething is the fact that this baby starts chewing on anything that they find around them. Whether it's edible or not, it's not even the point. They have itchy gums, like I earlier stated. So these itchy gums, they want to use something to help them scratch it. So most times you see them biting on things, even your body. If you're not careful, your own body, these children will start biting into your cheek, your chin, your shoulders, your clothes, their own clothes, and every other thing, their toys. They chew on them during this period because of the fact that most of the kids that start sitting started at the period when they start crawling. You will notice that most of these children come down with two major symptoms. The first is that they pass loose stools and they may start vomiting. Now, some of the reasons that this happens is because, like I said, they usually crawl. So when they crawl, they pick on items, and if your surrounding is not really that tidy or it's not that clean, it may affect them and they may start coming down with um, stools or vomiting. So we have highlighted all the pointers that indicate that the baby is about to start teething. what is your own responsibility? How do you handle that situation and make it easier for your baby? The first thing you need to do as a mother or a caregiver of a teething baby is to ensure that you increase your hygiene level. Yes, guys, you need to increase your hygiene level. Reason being that since it is the period that your babies put things in their mouth, they eat on items, they chew on items, whether they are edible or not, that is the point. You need to increase the hygiene. Talking about washing their clothes, washing their toys, and then cleaning up your surroundings, scrubbing very well, and then mopping around where they crawl, since they are mostly crawling at that stage, right? So it's important that you mop the surroundings where they crawl and they move around. Their toys, depending on the material that is used in making it, you can wash them with warm water or even boil them in hot water if that is the instructions on the toys. So yes, that is one point that you would do to help your teething baby. The second thing you would want to do is that you would want to make sure that you watch what you eat as a mother. Because most of these babies that start teething at that period, they are still being breastfed, you know. So once you notice that your baby is about to start teething or is teething, especially for those mothers whose kids are having to deal with loose stools, vomiting, and all those symptoms. You have to watch what you eat because, yes, what you eat by extension becomes what the baby eats. And if what you're eating is affecting what your baby is eating, then you might want to watch what you eat. Eat things that will help your baby's digestive system. Talking about fibers, fibers help to increase the volume of a baby's stool and then give it, make it thicker. The baby will easily pass it out. Another thing you want to do is, yes, you will watch what your baby eats. Of course, we know that, okay, even though the babies at that age can still be breastfeeding, we also know that they have other forms of feeding that is being incorporated in their diet. So you would want to watch what they also eat. That way, you will help your baby to manage the process. If you know that your baby is having to deal with loose stool, I would advise that you cut down on their commercial milk intake. Yes, not the breast milk, of course. Commercial milk. If you feed them on commercial milk, and maybe you're giving them, let's say, for instance, 3 spoons of milk, you might want to cut it to half of that. That's talking about 1.5 spoons per meal. That will help you to assist them in handling these situations because some mothers complain that when you give your baby milk at that period where they are having issues with their teething, you see that it increases the frequency of that loose stool that they are passing out. So yes, it's important that you lessen or you drop the quantity of milk that you give them per meal. Okay, that would help. I want to thank you so much for sticking around with me. I do not take this for granted. I guess I'll see you guys in my next video. Thank you very much. And by the way, if you're not yet subscribed to this channel, this is about the time to do that. I really appreciate you and bye bye.